It's 12:35 and I've been liking to start 5 minutes late, especially with the virtual presentations, just to make sure that everybody is able to sign in. But it does look like everybody that has signed into the link is here. So I want to thank Miss Allison for allowing us to all meet today and for me to provide this presentation to you all. I think that you guys are going to get a lot of great information personally, and the information is going to relate to how to write a resume, and then also best practices on interviewing. And this presentation, I've been doing it for a couple years now, but it gets updated every semester, and the updates include current research on what's trending in human resources, meaning that I'm making sure that I'm researching each semester for y'all, finding out what is current best practice on interviewing and resume writing, and you'll see what that really means, because things do kind of change every now and then, and you'll learn like the length of a resume is, kind of fluctuated in terms of how long your resume should be. Also how we interview nowadays, that has changed a little bit over the past few years. So, my job today is really gonna be to provide you with those updates. And it's all very nursing specific. This presentation is tailored to student nurses like yourself. So another reason why I hope that y'all will get quite a bit from this. We'll have some guests coming in later, Osher hiring managers, to talk to you all and provide you with some tips and advice on what they are personally looking for when they are hiring or interviewing a new grad. So hopefully that will help. But I'm gonna just continue on and showcase some objectives. And this slide really, these are my promises to you all in terms of what I'm going to be able to provide you with today. A lot of it's going to be what I consider guidance on both resume writing and interviewing. So guidance is going to be different than like clear instructions, because you'll find that everyone's resume is going to reflect a little bit of who they are as a person, and considering that everybody is different, no one is identical, everyone's going to have, a little bit of a difference between resumes, and that's a good thing. And so for me to provide, mandatory instructions on how to do something regarding resume writing is just not how it's done. But I am going to give you professional guidance on this is how it should look, or this is what I would recommend that you approach it through. But at the end of the day, it's your decision on what you decide to do. So I think it's important to note that. And then there are some clear instructions on how the interview process goes, but it's also guidance, because a lot of this information, even though it's been taken through research throughout different employers, I'll be using Ochsner examples, but you can use this information and these guidelines to apply anywhere, not just at Ochsner. You can use it to write a resume or interview at any hospital or clinic, pretty much in the United States. So hopefully that will also help. In terms of the flow of today's presentation, I'd like to provide this just so you can kind of get an overview of what we're discussing. It's quite a bit, and what I'll say is, in order for us to get through all these little arrows, the best way that I have found is that we hold any questions until the very end of the presentation. So if you have a question about one of the slides that I'm talking about, well, how about you just put it in the chat box, and I'll visit that chat box at the end, because I'll just say I have the tendency to get a little sidetracked when I answer questions during the presentation, and I want to respect everybody's time and not, take 4 hours to present, which, I'm not doing today, but I have done that before. So I want to make sure we get through everything in a reasonable amount of time. So we'll do the questions at the end if you have any, and you can just submit them in the chat box and I'll read them out at the end. And other than that, we're going to dive right into the resume writing portion here. And what I like to do first, before we get into the elements of the actual resume, is to discuss pre-resume items. And pre-resume items would be the cover letter. Now, the cover letter is I consider it to be a pre-resume item because it's typically saved separately and is typically seen as a separate document apart from your resume. So it's typically saved as Sam Furman, that's my first and last name, cover letter, and it's its own document. And I would recommend that you save this as a PDF file as well. But this is an optional professional document to create, or at least to submit when it comes to submitting your job application. Now, if Ms. Allison has y'all doing this as part of your assignment, then obviously it's not optional. I'm still going to go over how to write one of these, but just know that when submitting your actual resume into a job application, you really don't have to have a cover letter. In the past, it used to be required, and this is an example of that. Those trends that change, in the past, it used to be mandatory requirement, now not so much. But it is very effective to create one if you want to communicate some of the key reasons why you would have one. And I'm also going to cover some information about your objective statement, which is different than your cover letter, in that your objective statement will be on the actual resume. So your cover letter is not part of the resume itself. It's typically saved separately, but your objective statement will be on your resume, and it's typically at the top. I'm going to deep dive on each one of these too, by the way, but your objective statement is also optional. So if you find that after we explain how to write an objective statement and you believe that it might be too confusing or it's something that you're not interested in doing, just know you don't have to do it. But to review how to do the cover letter, if you want to do one, I like to describe it as having compartments. I think that's the best way to approach it. And this little visual here is an example of what you would do for each paragraph. And by the way, if you signed in, I'll send everybody that signed in this presentation that has all this information, so that you don't have to write all this down. You'll get all of this verbatim in an email after we complete the presentation today. But typically you want to make sure that you start out a cover letter with addressing the addressee by doing "to whom it may concern," or "dear hiring manager," or if you know the name of the organization, which you should, that you're applying to, you could do "Dear Oshner hiring manager," for example. But you can make it pretty general in terms of who you're addressing it to. But you would also then want to start out with an opening paragraph. So look at your cover letter as a 3-point paragraph document or report, if you will, but it's really a report about who you are as a professional. So your first paragraph in this personal report here is going to clearly state your intent and purpose for submitting the cover letter, which is typically going to be the purposes that you're applying to a particular position. And you want to be sure to actually indicate that particular position so that you show intent and you're intentional in this professional document, so the hiring manager knows you are specifically interested in their job. So that means that if you apply to 5 different jobs and you want a cover letter for each one of your applications, you're going to need to edit those cover letters and you'll have 5 different cover letters. Now, it might be the exact same information, but you're going to be changing the name of the position that you're applying to. So, that's one of the big things you want to pay attention to. If you do have a cover letter, you need to be intentional and specific to these jobs. And that might have not been the case in the past, but it certainly is something that the hiring managers and recruiters are looking for right now. It's intentionality here. So then your second paragraph is an opportunity for you to describe a little bit about who you are as an individual. I've had people describe in their second paragraph their professional background, and particularly if they have transitioned out of a non-clinical profession and now they're going into a nursing role. Sometimes they want to explain what caused that. I've seen people talk about how they got into car accidents and they were in banking but got into that car accident and was really inspired to go into nursing because of the care that they received in the hospital by their nurse, and it made them want to go into nursing school, or that has happened with a family member. If you have that type of story, you want to share that, that would be a great place to put that information in a cover letter. So that would be a reason why you would maybe have a cover letter, is if you're that type of person that wants to talk about stuff like that, which is important. Or if you want to explain your why nursing, like why did you get into nursing in general, this is a great area to put that in. I'm going to talk more about other reasons why you would want to create a cover letter as we progress, especially when we talk about the one-page resume, which is definitely something that we're going to talk about. I know that's it's really hard for people to grasp that concept, but for new grads, really only for new graduate or for any entry-level job or position, you really should be submitting a one-page resume. That's even if you have 20 to 30 years of experience in, in something else in a non-clinical area or even clinical. If you're applying to a entry-level position, you really should be submitting a one-page resume, which, like I said, I'll go over that in detail in a little bit. But anything that you have to take out of your resume to make it one page or parse down, you can talk about it in more detail in your cover letter. So if you're really upset that you have to pull out information on your resume because you have to make it one page, don't worry, you can include that information in your second paragraph in your cover letter typically. And that would be another great reason of why you would have that cover letter document. And your third paragraph in your cover letter would be that the closing paragraph, which is essentially you wrapping the whole discussion up on why you're submitting this cover letter. It's going to be in regards to a particular job. And a lot of times individuals and applicants will connect the organization mission, vision, or values that they've researched with their own. So I've seen people reference the Ochsner values, for example, which include teamwork, integrity, excellence, and among others. And they'll say, I'm really looking forward to hearing back about my application for the GI surgical step-down unit. I really believe that I can contribute toward the Ochsner values by providing excellence and teamwork and integrity, and that, in my job. And that's something how you could wrap it up, for example, but really make it how you want it to be. It's, like I said, very personal. It's your personal cover letter for a very personal yet professional document describing you. So make sure that it is reflective of who you are. And like I said, if you feel like this is too much, you don't have to have a cover letter, because what you don't want to do is write a poorly written cover letter or a cover letter that misses the mark, because then in that case, that could actually hinder your chances of getting a job over you just not sending one at all, because like I said, no one's searching for a cover letter anymore. But if you write a poorly written cover letter, that could possibly hinder your chances of getting a job. So you just want to make sure it's done intentionally and with purpose. And the objective statement is, like I said, it's different from the cover letter because your cover letter is a separate document from your resume, but your objective statement is typically going to be at the top of your resume, right under your personal information. So for me, this would be, my name's Samuel Furman. So at the top of my resume, it would say Sam Furman. Right under that, it would say, it would have my contact information, my email, and my phone number. And then under that, if I wanted to have an objective statement, this is where it would be. It would be right under my contact information, typically toward the beginning of the resume. And if you were to write an objective statement, you would want to be able to communicate 3 specific points. And it would be, how would you describe yourself? That would be the first point. What position or organization are you applying to? That's the second. And then the third would be the why. Why are you applying to the position? So it's really like who, what, why, or how, what, why. Those are the 3 things that you would want to hit on the objective statement, but you would want to make sure it's not too long either. But we're going to go over an example too of an effective one. But if you know that you're not the type of person that wants to get involved with describing yourself or getting into this, you don't have to have one, like I said. But this is another area that if you write a poorly written objective statement, it could be taken as, you know, a strike, if you will, against your application, rather than not just, you know, not having one at all, which is, you know, no strike really, because they're optional nowadays. But if you do decide to write one, it needs to be effective. And I've included what I believe an effective one here. And your objective statement needs to be very focused and intentional on the job as well. Because remember, your cover letter is the same thing. And the example I used earlier is that if you apply to 5 different positions, you're going to have 5 different cover letters. Same goes with the objective statement and essentially your resume. So if you apply to 5 different positions and you want an objective statement for each position, you're going to have 5 different versions of a resume that go with each position that you're applying to. So this example is actually information I pulled off the Oshler career site for a GI surgery step-down unit position. And I have the job duties listed because the other part that you want to make sure that you think about if you decide to write an objective statement is pulling out some of the information that the employer is saying that they're looking for and including that in your objective statement. The reason why you would want to get involved with that is that some organizations have computers that scan resumes instead of, you know, people. A lot of that is because they might not have enough people to review all the resumes, but what the computer is looking for, they're scanning to see who's qualified for that job. And the computer is essentially searching for specific words that are associated with the job that are part of the job duties, and they're looking for those words on your resume. Now, not every organization does that or has that software. I know Oshler doesn't because we have enough humans to do that, but some smaller companies or organizations that don't have a large human resource department will have that computer. So this is why I would strongly recommend that you be intentional. And this goes back to the intentionality of your whole resume. Don't do anything generally. If your objective statement is going to be new grad RN from Fletcher Community College looking for a job, and that's it, that's an example of a poorly written objective statement that you might as well just save that space for something else that is, you know, more effective and just not have one. You really want to be more intentional about what specific job you're applying to. So this example objective statement based on this job would be newly graduated registered nurse seeking to begin my career within the GI surgery step-down unit at Oshner Medical Center so that I can provide compassionate care to a diverse patient population. Now, the only issue I have with this objective statement is that it seems a little bit long, but I can look past that because they've done quite a few things that I would support, which the first is that they've looked at the job duties. They have seen, they've talked about patient care and patient populations, and they use the word diverse, which I also believe is indicated here in the job description. But they've also indicated the specific name of this job, the GI surgery step-down unit. And think about it in this way too. If you were the hiring manager for the GI surgery step-down unit, would you want to be receiving resumes that had the name of your unit on it intentionally or not? And I'll give you another example. If you had two resumes, one resume had this objective, it said, the GI surgery step-down unit specifically, and then the other resume just said that they were looking for a job with no specific position. And what would you do as a hiring manager? Would you look deeper, or feel like you would want to move forward with the person that is intentionally looking for your unit or not? The majority of us would be more interested in the candidate that specifically put that unit's name typically. So, and that's just the insider scoop too. That's what these hiring managers are looking for. And that's what they're really going to, that's going to help you shine essentially. And that's how you're going to have a more effective objective statement, is if you pull out these specifics from the job description. And I know it's going to be labor intensive, and I know it's going to require detail and focus, because you're going to have to, have different versions or copies of your resume, especially if you apply to various or multiple positions. You're going to want each resume to correlate with a certain position you're applying to. So just be cognizant of that, and make sure you save these documents in a manner that's going to be easy for you to remember, because what you don't want to do is send the resume that you have for the GI surgery unit and send it to the med-surg unit at North Oaks. And that's happened too, where I've received objective statements that were very intentional, but they were actually for different hospitals. So be careful on how you save these documents so that okay, these resumes go to this hospital, these resumes go to this one, and, and have them saved in a way that you'll remember. And I have an example too of what that looks like. I'm gonna kind of skip around here, but if you go to the document name where it goes to resume formatting, this would be, in my opinion, the ideal format on how you would save it so that you would know exactly what resume goes where. So you would do your first initial, period, last name, underscore resume, underscore the position name. So this example, my name's Sam Furman. So there would be s.firmin underscore, it's my resume, underscore the GI surgery step-down unit. And always save as a PDF when submitting to an employer. Because if you leave it as a Word document, then you allow your resume to be edited essentially. And that can be done sometimes without your permission. And not like that's, there's anything that I know of that has been nefarious that I've seen. It's just, you don't want any of your formatting to get, thrown off, because I have seen that where people save and submit their resume as a Word document, and we receive it, but their formatting is all thrown off because in the transition process of them sending it to us, the format gets, all messed up for some reason, but with the PDF that wouldn't happen. It's pretty much going to be locked in there when it's saved. And I'll say if you decide to do the cover letter, it would be very much the same, in my opinion, and it would be my recommendation that you save it similarly to your resume, but just instead of it saying resume, it would say cover letter, you know. And it doesn't have to be exactly like this, y'all. I just want to give you, you know, something to go off of in case you're having trouble with figuring out how to save this stuff. This would be a great example. If you already have your own way of doing this that makes sense to you, continue to do that, you know. But if you need some guidance on how to do this, this would be a great format to use on how to save. Now, in terms of the actual format and structure of your resume, you do want to make sure you're going to use a template. Now, I would definitely not recommend you pay someone money, you know, from private firm to create your resume. And I say that because I've seen it happen. And I think that just the fact that y'all are all almost done with nursing school, that to me automatically makes you 100% capable of doing this, because, you know, if you can get through the hardships and difficulties and the complexities of getting through nursing school, your resume is going to be something that you can 100% do. I know it's going to be extra, an extra step to do in addition to everything else you have to do with your nursing school, but it's something that I think you could save your money on and do yourself, especially after getting this presentation. So make sure you go on the internet even, and you can Google free resume templates, or if you have the Microsoft Word software, there is an opportunity to open that software and type in resume template, and you're going to get a whole bunch of really great templates to use. Some you don't want to use, which I'll show you the ones you don't want to use in a little bit, but you want a template because these templates have pre-structured formatting in place so that you don't have to worry about spacing or hitting the tab bar, the space bar 10 times to make sure you're 1 inch over. That's all done for you in these templates. And so it will help you have a more presentable appearing resume. And I call it, you know, you don't want a sloppy resume where, you know, you have one title indented twice, but your other title is only indented once. Or if you have the objective statement bolded and underlined, but the next section of your resume is only bolded and not underlined, that's inconsistent formatting. With a template, that would already be in place for you. All you would have to do is just type the words in. Because if you have an inconsistent or a improperly formatted resume, some recruiters and hiring managers will take that as poor attention to detail. And you don't want to be associated with having poor attention to detail, especially as a new grad nurse, because we all know, and I won't hammer this in too much, but we all know how important, you know, attention to detail is. That whole concept is within nursing. But I have seen it where the correlation is made between someone's sloppy resume and their ability to be attentive to these small things. You definitely want to look at your resume as a reflection of you on paper. So it would be like you going into an interview, you know, with your hair combed neat, all professionally dressed. That would be the equivalent to a properly formatted resume, in my opinion. You know, an improperly formatted resume or a resume that had very poor attention to detail would be like you going into an interview with mismatched shoes or something. And that it's that intense, in my opinion. And I really am belaboring this issue because it's the most common error that I see with students, is that they forget to stay consistent in their formatting. you know, they'll add a period to one sentence, but then not to the other. Either put a period at the end of all your sentences or don't put a period at all. And it goes back to whatever you want to do on how you format, it's up to you, but it's about staying consistent. And so just be cognizant of that. Now, these small details I like to review too. In small details, I mean like the font type. With the pre-made template, a lot of this is already in there, so you don't have to worry about what font, because these templates will come in either Times New Roman, Calibri, or Arial, or another. These are your main 3 professional fonts, but there are some other ones that are under the umbrella of, you know, professional fonts, but these are your main 3 in my opinion. So try to go with these. One of these, don't mix them. You want to go with one font type and stay consistent. And with the font sizes, you can have various font sizes throughout your resume, but don't go any bigger than size 20 and don't go any smaller than size 10. And that goes with any one of the font types. So let me reiterate that one more time. When it comes to the font type, such as Times New Roman, Calibri, Arial, pick one and stay consistent all the way through. Don't change or mix any font types, but you can mix and change your font size. But just make sure you don't go any bigger than size 20 and any smaller than 10. Usually your biggest font size is going to be at the top, indicating your name. And that's typically where that's the most professional in my opinion, or your objective statement or education certification. The titles of your resume sections might be a little bit bigger than the information under it, and that's okay. Just stay consistent. Meaning if you decide to have a size 15 font for your first section heading objective statement, your education needs to also be size font 15. So hopefully that is all, you know, coming in loud and clear to y'all, because that's pretty important. And like I said, some of y'all might say that's too technical, or like, who really cares? I would really implore that people do actually look into that. So do yourself a favor, spend the time now, get it right so that you don't have to worry about it later. And the spacing, like I said, indenting, underlining, bolding, be sure you pay attention to that stuff because it is important to the whole concept of having effective attention to detail. And the most controversial, you know, is the length. When I first started doing this presentation a couple years ago, the trend at the time was, you know, all the major employers and career readiness websites were saying it's okay to have more than 2 pages for a new grad. But over the past year and a half, that has shifted. I don't exactly know why. I'm just here to communicate that it has shifted, and the hiring managers at large are looking for no more than 1 page of your resume if you are a new grad or applying to an entry-level job. Now, once you get more experience and you start applying to manager or charge positions or a supervisor role that are not entry-level, then it's appropriate for you to have 2-3 page resume. But for an entry-level bedside position, the hiring managers and recruiters are really looking for no more than 1 page. And I'll say, you know, some of you might say, well, the hiring manager last week said that my resume could be 2 pages, you know, and that's true probably. You're going to have one-offs. But if you look, and what I'm trying to explain is that if you look at the hiring managers at large collectively, not just these one-off hiring managers, because I know hiring managers that are completely fine with new grads having 2-3 page resumes, but we don't know if you're going to get that hiring manager, or if that's the hiring manager in charge of your position that you're applying to. So that's why it's better to go about it as a one-page approach right now so that you don't make any mistakes for anybody that's looking for that one page. And for anyone that doesn't care, then if you send them one page, they're going to be fine with that too, you know. But the general advice that I'm here to provide is that y'all really should you know, stay to the one-page resume if you're applying to any entry-level position. And I'm going to talk about strategies on how to do that. So anyone really nervous or freaking out, don't freak out just yet. I'm going to review how to do this. But I did want to go over something really kind of funny because when I started talking about the templates and using Microsoft Word, at the time I didn't know that they had some templates that I definitely would not recommend. So if you go on Microsoft Word to search templates, there are a lot of wonderful templates to use, but there are ones to avoid, and these are the ones you would want to avoid. Any template that's asking you to put your picture, please don't use that one. Or any resume template that is providing you with like purple, yellows, reds, you know, avoid those. You want to stay with the standard, most professional approach to the ink, which is going to be black only. The only other acceptable color on your resume would be the light blue. That happens when you hyperlink your email. But other than that, you really should be using black ink only. And this May Riley, and hopefully y'all all could see the visual. The issue with hers here, which this is a fictitious person, May Riley was pulled off of the Microsoft Word template, I'll just say. But the issue with this one is that her margins are so narrow. You want to not go that far out on your page with your margin. So I would recommend maybe a ½ inch max in terms of the narrowness. And I know she probably had a lot to include on her resume, which is why she probably wanted to keep it to one page, but don't go too narrow like this individual did. And I'll say the issue with this last one, which is actually someone's resume that I did get not too long ago from a school in Louisiana, is an example of someone who had actually great information on her resume, but it was not provided or presented in a way that was effective at all. So you really want to avoid any type of template that is asking you to put information vertically and horizontally in the same section of the page where they're intersecting perpendicular. You avoid that. Make sure that you are putting in your information top down, reading from left to right, not intersecting at all, because that's just going to be visually confusing. Yes, we can read it eventually, but you don't want to throw anybody off immediately just by the format of your resume. And they're going to be like, you know, before they even read anything, they would be saying, wow, this is an interesting looking resume. You don't want to have that experience. You want to make sure that it's going to be understandable and readable. And right now, typically we all read left to right, top down. So that's why I provide that guidance. You really want to make sure you're gravitating toward these templates that kind of look like this. Yes, they might appear a little bit more boring, quote unquote, than the other ones, but these are going to be the most professional for you as a student nurse. These are the standard templates that we're looking for as recruiters and hiring managers in the healthcare industry. These other ones might be okay for like models or like graphic design, but that's not what we're applying to, right? So you want to make sure we're looking at these types of resumes that are very structured looking and they have that clean and neat look, if you will. So make sure you gravitate more toward those types of templates. And one of the the things I definitely want to include too is a list of adjectives, and these are really descriptive adjectives that you can use and incorporate to help describe yourself either in your cover letter or in your objective statement. So if we looked at the objective statement going back, it says newly graduated registered nurse. So the adjectives here are newly graduated. That would be a descriptive adjective to describe the noun, which is registered nurse. And I'm not going to go into a grammar session here, but one thing that this individual could have put is dynamic, newly graduated registered nurse, or energetic registered nurse, or newly graduated and energetic registered nurse. Yes, it might make it a little bit longer, but I'm trying to give examples of where you would use these descriptive adjectives, okay? You want to make sure that you definitely pepper in some effective adjectives that will help describe your personality. If you're resourceful, or if you're adaptive, which are honestly great ways to be described as a new grad nurse, in my opinion. Put that in there. Or compassionate, that's a great buzzword right now. In healthcare, it's been a great buzzword for the past few years. And it's also actually an Oshner value. But if you describe yourself as compassionate and you submit that objective statement to Oshner, we're really gonna have our ears perked up, because like I said, that's a great word in general, but it's an Oshner value. If you've done Oshner research, which I'll talk about why that's important in a little bit, but these are all great ways to describe yourself. You don't want to use empty. The term is empty descriptive adjectives, which are good or great, and without getting too much in the detail with those words, but the word good doesn't really describe anything in particular, or it could be used to, you can use the word good to describe a whole list of different things. You could talk about good job or good produce or good, water, it could be anything. But if you use these intentional descriptive adjectives, they are very helpful in describing nouns like yourself, like what you're all about as a new grad registered nurse. So that's why I have this little list here. I also have a list of action verbs. Now, these are going to be important when you're going to start writing out your job experience or your work experience, because each bullet point that you're going to include under either a job that you've had in the past or a clinical rotation that you did during school, in order for you to describe what you were doing in those roles, you're going to be starting out with action verbs. Your resume, you're not writing in complete sentences like I performed routine vital assessment for during patient rounding during my med-surg clinical rotations. You're not using the word I or me or those personal pronouns on your resume typically. You're starting out with action verbs. Performed, basic assessment or standard nursing procedure during clinical rotation, or educated patient during discharge, not I educated patient. So hopefully that makes sense. You could use personal pronouns though in your cover letter, and that's another reason why, or if you're that type of person, which I would describe myself as that type of person, who likes to talk or who likes to write and is very personal and likes to use I and me when writing, the cover letter is that place to do that. Your resume is not. You're trying to be very abbreviated with the information, hence you're starting out with action verb immediately. So if you already have a resume and you might be thinking, I don't think that, I need to do much of anything else, which might be the case. I would really recommend that you look at this list when I email it out to you and see what you can replace with something that you have already. If you, for example, have started out a bullet point with the word assisted and use assisted again for another bullet point, maybe diversify your language a little bit and use another word, maybe assessed or arranged instead of assisted, if it makes sense. But try to have a little bit of a diversity with the language. And that's why I have these verbs to use and then the adjectives. I think they're going to be really helpful for y'all. And these words too, by the way, were pulled from a nursing specific resume writing presentation too that was provided by Harvard. So this is a great tried and true list for both verbs and adjectives that I would definitely support, which is why I've included here. So now we have our words. You want to be able to put these words together to then construct your work experience. And over the years and through the research that we've done regarding new grad resumes, we've identified 3 major areas that you can include as part of your work experience. The first major work experience area would be the clinical work experience. So these would be jobs, if applicable, that you've had, where we're talking about medical assistant role, certified nursing assistant role, nurse tech role, PCT role, patient care tech role, nursing assistant role. I know a lot of hospitals have different ways of calling CNAs. Some call them CNA, nursing assistant, externship sometime if it's paid. But if it's a paid role that has been performed in a clinical setting, that's going to be considered clinical work experience. So the second type of work experience is non-clinical work experience. These are jobs that you've had, if applicable, that are waiter, waitress, bartender, retail associate, checkout clerk. And I'll say these areas are really important to include if you have them and you feel comfortable, because as we go into the next slide, we're going to talk about transferable skills. There's a lot of skills that are performed as a waiter or waitress or bartender that can be applied to your job as a new grad nurse or bedside RN. And like I said, I'll talk more about what those are in a little bit, but this is why you would want to include non-clinical work experience if you have it. And the third type of work experience to include would be your clinical rotations from school. And I've added that, and we definitely took some time to verify if this was something to add as for students, but it is, especially if you don't have non-clinical work experience or clinical work experience, meaning if you're that student that went right out of high school into this program, you know, and didn't do a lot of part-time job work, or you were just focused on school, and you're at a point where you're trying to write your resume and you don't have any work experience, well, we would advise that your clinical rotation experience is very much relevant to that section of professional work experience, because you are essentially you're getting exposure to a clinical environment, and we all believe, as in the HR community and the hiring managers believe, that you are working to an extent, even though you're paying for that opportunity by being a student and being enrolled in a nursing program. It's still appropriate to include within your professional experience, because you have to put something in there. And I think that's what it goes back to. You really need to have something to show what you've been exposed to, so that we know kind of what you're coming in with. And like I said, even if you're not coming in with any paid work experience, whether it be clinical or non-clinical, we all know you have to have done, I don't know if it's 600 hours anymore, and I know it's kind of varied now with the whole working remote business with the COVID-19 pandemic, but you have to have had a certain amount of clinical hours to get through nursing school. So you'll want to include that if you don't have non-clinical or clinical work experience. So, and that would include any preceptorship that you've done, internship that you did, like a summer internship. If it was paid though, it would go in your clinical work experience. So I know sometimes students have the externship that was a paid role, but it was set up through your school. If it's paid and if it's gone through your school, then it should go into your clinical work experience. But if it's not paid and it was you just doing your clinical rotations as a group or a individual preceptorship that was not paid, it would go into your clinical rotation experience. And within each of those areas, you really want to make sure you include relevant experience. Now, some of you will say, well, what does that even mean? Relevant experience goes back to when I was talking about that computer that's looking for certain words sometimes, meaning when you submit your resume to a specific job, some organizations have a program or a computer that is searching for words on the job description and trying to verify, is it on your resume to see if you're qualified? This is why you want to include relevant work experience and be focused on how you communicate what you were doing in each one of those roles, whether it be clinical or non-clinical. And the way that you do that is you hone in on transferable skills. And this is the definition of a transferable skill is an ability or area of expertise which might be used in a variety of roles or occupations. Transferable skills are sometimes called soft skills. And soft skills, and or transferable skills are ability to work in a team. So teamwork would be a transferable skill. Or time management, that's a transferable skill. Time management is important within the world of nursing, but it's also important in the world of the restaurant business, because if you're a waiter or waitress and you have 5 tables, you need to make sure you understand how to manage your time to where you're providing each of your 5 tables with the amount of service that is needed to provide them with great customer satisfaction score, which customer satisfaction can be transferred over to patient experience. So that's what we are talking about when we mention transferable skills. It's teamwork, time management, being able, compassion is actually can be considered transferable at times. And that's also in contrast to technical skills. So technical skills are all those technical nursing skills that you might be reviewing in school, like how to insert a catheter or how to read vital signs, like skills that can be taught within the context of, of a book at times, or even in a certain setting for a certain amount of time. Transferable skills are typically harder to acquire and take a longer amount of time to reinforce. And that's why you'll hear a lot of times like hiring managers say, I just need someone with a positive attitude. I can teach them how to be all the technical skills of how to be a great nurse, but I can't teach how to be positive. And that's a positive attitude will be a transferable skill as well, because you can have a positive attitude as a nurse, you can have it as an HR person like myself, you can have it as a teacher. So that's what you want to make sure you look at when including your work experience. So I'll give you an example of how to, more of that too in the next slide. But I do want to make sure I include some technical information about your work experience, which includes the tense. So we talked about action verbs, right? That's performed, that's assisted, that's included, those words. But look at those words, they all end in ED. So that would be considered past tense. So with the words that end in ed, typically that is a indicator of the past tense being used to describe your work experience. And the present tense would be using the word perform versus performed would be past tense. So those action verbs without the ed would be in the present tense. Those with ed would be in the past tense. So I make a big deal to a certain extent about this only because I've seen people get confused with the tense, and they might have past tense at the bottom of their resume where they're talking about previous work experience, but then they'll have the present tense with the current job. I know a lot, and I'll say this, there's no surefire formula on this. So some hiring managers and recruiters are okay with you putting your current job, if you have a current job, in the present tense and all former positions in the past tense. But I would say stick with one and use it throughout. So, and in that way, you're not confusing yourself, or you're not swapping tenses in the middle of your resume. You're using the same throughout. And my personal recommendation would be to use the present tense, just because if you use the present tense, even with the past job, it's showcasing that even though you've done it in the past, it's still something you can do now. And sometimes when people read words or verbs with the past tense, it might be interpreted as, oh, that's something that you used to do, but can you still do that? And like I said, you want to include relevant experience. So you want to include experience that relates to the job that you want. So you want to make sure you include positions that you've had in the past that are going to help showcase that you have the skills for that bedside nurse job that you want. So that's why I would say use the present tense, because you're going to be talking about experience that you have that you can presently use and then also use in the future. But if that's confusing, which it could be, and I apologize, if that's confusing, then I would just recommend use past tense or present tense throughout. Just stick with one. Just stick with one tense and use it throughout. But that was my I want to explain my rationale for using the present tense. And then also, you're going to be listing your work experience in reverse chronological order, which means the most present work experience will be first, and then you'll go to the least present. So if you've had a job in 2020, you would put that at the top. And then if you had a job in 2018, you'll put that under your 2020 job, or put it after, and go in that order. And I'll say if you have, for example, clinical work experience and non-clinical work experience, you would start for your first section, which would be clinical work experience, with the most recent to least recent clinical work experience. But then when you would get to your non-clinical work experience section, you would start all over again and put the most recent non-clinical work experience to the least recent. And hopefully that makes sense as well. But each section is going to go in reverse chronological order. If it's two sections, you'll start with the reverse chronological order from the top. Hopefully that makes sense. I didn't confuse anybody, but that's important to note as well. Now, what constitutes as relevant work experience? This is a made-up example that I pulled, but I have seen a lot of resumes. The really long resumes that I've seen have had to do with applicants that have had a lot of work-intensive jobs in a previous life before they decided to go into nursing, such as a store manager job, which, you know, that role includes a lot of responsibilities, but some of those are not going to be as relevant to the job of a nurse as other responsibilities within your role as a store manager. And so your job, in order to include the relevant work experience, is to really look at what you were doing and seeing how relevant is this to my job as a future RN. And so if we look at this, this is a list of at least 10 bullet points. That's making, someone's resume probably too long. And the idea is for each job that you list or work experience, you should be putting no more than 4 bullet points. Usually 2 to 4 is a great little mixture, but no more than 4, because then you would really have to reassess, am I including the most relevant information considering that I'm applying to this particular job? And so with this, hire, train, and oversee new staff, that was an important role for your store manager position, but are you going to be overseeing, a big staff as a entry-level RN? You might be overseeing the nurse ancillary team, but that might not be as important to include as putting information like this, which would be deliver excellent service to ensure high levels of customer satisfaction. That would be a responsibility that you have as a store manager that would definitely correlate to your role as a entry-level nurse, because the transferable skills here are service and customer satisfaction. So, and that all goes back to the patient and being able to provide the patient with the best bedside care. And so that's why that was kept there. And then compliance and the administration duties were probably very important to the store manager role and could arguably be correlated with your ability to comply with the nurse care model or plan of care for that particular patient, staying compliant with that, you letting the employer know that you are familiar with adhering to compliancy rules or standards could be helpful with underscoring that. And then also undertaking very sensitive information like store budget and financial records could correlate to you having having access to sensitive information such as patient records or confidential information through the EMR, the electronic medical record system. So that could be one of those transferable skills that you're trying to relate to. I would even try to make it more obvious if that is what we're trying to relate, the managing store budget and updating financial records piece. And if we're trying to relate that to confidentiality, I would even throw in the word, confidentiality in that too, which isn't included. But anything that helps you underscore that you are qualified for that job that you're applying to and those job duties. Take out those words from the job duties and include it in your previous work experience if it's relevant. And I'm going back just to see if that's something that we can do. Nursing process effectively uses the nursing process in the delivery of patient care. That kind of went to the first bullet point that we address in that store manager role, being able to effectively use, or adhere to compliancy processes to deliver customer care or customer satisfaction. You're not making information up because that is what you were doing in your role as store manager. You're just tailoring the language to be more relevant to the job that you're applying to as the registered nurse role on GI surgery step down unit. So it is going to require extra time, and I know, and I say that again. I keep saying that only because I've had one-on-one experiences with students, and this is the part that's always kind of very laborious. And they're like, "Are you sure we have to do this?" And my answer is always, well, if you want the surefire interview just based on your resume, then yes, this is what you want to do. You want to be very intentional. You don't want to be general. with the information on your resume. You want to be specific. So, and that's what we're trying to accomplish. We're trying to accomplish a resume that's going to be very effective, and so effective that you're going to be called for the in-person interview. And so that's why we want to approach it in these ways. And this is just an example of an actual work experience that I have pulled off somebody's resume. I won't go into the details because I'll let y'all see this when I email the presentation out. But I'll say in terms of the formatting, they listed the hospital that they worked at, the dates that they worked at that hospital, and then the name of the position that they held in the unit. So if they wanted to enter and put the city and state under the name of the hospital instead of parentheses, that's fine. They just need to make sure that they do that same format for every other work experience. So putting the city and state under the name of the hospital that they worked in. But in this case, every other work experience that this person had on their resume, they should be putting the name of the place that they worked at, parentheses, the city and state, close parentheses. And that's what I mean by that consistent formatting. So, because like I said, inconsistent would also be having the open parentheses here by Hammond, but forgetting to put the closed parentheses there. And that I've seen a lot too. Very simple stuff, but it would take you going over a second time, sometimes a third time, reviewing for these details. And your resume is worth looking over 2 or 3 times. Trust me on that. And this is an example of non-clinical work experience that you could put. I will tell you right now that I've had a hiring manager specifically say, I'm looking for a new grad that has had bartending experience. And I remember saying, and this was years ago when I first joined Ostern, and I was like, well, what do you mean? Can you explain like why? And essentially this hiring manager was a bartender back when she was in nursing school, and she knew how difficult and also how relevant the bartending experience would be to the role as a bedside nurse on her unit, because, as a bartender, she explained, it's about making sure that everyone is getting their drinks on time, but then also dealing with people who may not be in the right state of mind all the time. So it's kind of like, how do you make your customer compliant, or tell them, hey, like, you got to get cut off, no more drinks for you, and how that's relatable to, making sure that you communicate and educate your patients. So apparently there's a lot of transferable skills between that bartending job and her opening on her unit. So that's why I'm always going to say, if you have non-clinical work experience and you're comfortable putting it on your resume, you really should do that. And this is an example of the student clinicals on how you can put this in. I advise, if you decide to put your clinical rotations from school, don't just put 1 or 2 in, put them all in. And so that's why if that's going to make your resume, 2-3 pages long, then you might want to rethink of maybe you should just put your clinicals from school and not your non-clinical work experience, because we still want to make sure that you get in that 1-page parameter rule for your resume as a new grad. But I definitely believe if you want to put your student clinicals, definitely try to put all of them, because we would want to see what have you been exposed to throughout your time in school. Because even though you may not think that clinical rotation, for example, in women's services is relevant to the job that you're applying to on a adult med-surg unit, but you may not know that med-surg unit has a wing that also acts as a antepartum and postpartum unit for the women's services, department upstairs in the hospital. So in that case, you would want to showcase, in my opinion, that you rotated through those units, or that you had that type of clinical education because that could actually be important, unbeknownst to you. So that's why I'm someone who's always gonna recommend putting all your clinicals, not just one, if that's what you do, if you do decide to put your student clinicals in there. But I've seen people put in the hours too. They won't just put the month and year for start date, and then they'll do the end date, but then they'll put 180 hours or 90 hours. That's optional. Just stay consistent on what you put. So if you put the start date and end date for your pediatrics unit clinical, then make sure you put the start date and end date for the next one that you indicate, not just start date. And even if it's a clinical that you know you're going to have, but you haven't done it yet, you can put anticipated clinicals one as well, that you know you're going to perform. You just may not have done it yet. You might be doing it next semester. Because I know at Oshner, we take applications early, sometimes even one semester out for some applicants. So you can put anticipated clinicals if that's what you decide to put, if you put that section in. So moving on into the education section. So now we've exited your work experience section, and this is going to be a separate section typically. It's education. And you'll want to include the name of the institution that you're attending currently. If it has a specific campus, you can also include that name as well. The degree that you're pursuing or that you have already received, and the year that you received it or the year that you anticipate to receive it. And so I'll also say, if you have other degrees that you've completed, there's really no specific way on how to list it, meaning that if you have a master's degree or bachelor's degree in another, non-clinical or non-nursing area, maybe it's English or communications, but you come back to nursing school now, you can put your current nursing school and program at the top of your education section, and then put your already completed bachelor's degree under that. That's fine. But I know some people who like to put their most advanced degree on the top, even if it's completed already, and then put the least advanced degrees following. It's up to you. I am typically going to recommend, though, that you put whatever you're completing currently first. But if you've already completed it, put whatever is most relevant to you first. Essentially, if you're applying to a nursing job and you already have your nursing degree and you're submitting this resume to that nursing job, you're going to want to put the fact that you have a nursing degree first in your education. But it's up to you, essentially. And hopefully I didn't confuse anybody on that, but it's really up to you if you have multiple degrees. But I'll say your education section is also an area where you can include current certifications and license. And I've even seen resumes and for individuals that have multiple certifications, they might even make a completely new section under their education and put certifications and license, and they'll list them all. But if you have just one or two and you don't want to make a whole new section for certifications and license, you can include that in your education section as a bullet point. But they need to be current. Anything that has been expired, we all know, especially within healthcare, that's not relevant. It's all about, going back to compliance. Whatever's current that you're legally allowed to help support any type of scope of practice, that is what you would include. If it's been expired or if it's pending, but it's still expired, please do not list it on your resume. That would be a great thing to put on your cover letter, though. So if you, for example, if you had an EMT basic certification 3 years ago, but it's expired now, but you still really want to tell us that you had EMT basic certification, you don't put that on your resume, but you could talk about it in your second paragraph in your cover letter. So that would be another reason why you could have a cover letter, is to talk about any expired certifications that mean a lot to you, but they're expired. Only current information, current license and certifications on your resume. And then typically we're entering the lower areas or the bottom of that one-page resume, going into the extracurricular activities. These are activities that you are doing that are considered extra to your current curricular or curriculum within nursing. So I say it that way because you want to put extracurricular activities because it shows that you're doing well in your nursing program, plus you're doing extra, meaning that you are able to juggle multiple things and excel in all of those areas. Now, I'm not saying that you have to have extracurricular activities because a lot of us don't. But I think it is important for those who do and are involved with extracurricular or co-curricular activities that you do include it, because it does showcase your ability to multitask, to go back to those transferable skills, to lead if you were involved in leadership. It helps elevate your soft skills that we spoke about. Just make sure that whatever you include in extracurriculars section, you do it in an organized manner. I just will never forget the resume I received a few years back, and this person was really involved, but their extracurricular activities were just strewn out with commas, no bullet points, and it was just a chunk of words at the bottom of the resume. It was really hard to process, just to read, and I'm a reader myself. I love to read, but it was just a lot of information that wasn't really organized effectively. So just be sure, and that's why I have example A and example B. You want to go with example A where we're using bullet points, and not go with example B, which is not as organized as the other one. So just be sure to use bullet points. Bullet points are your friends. They're going to be your friend on the resume portion, because it really helps organize the content and allow it to be very easy to read. And that's just a fact. That's, everyone is going to read bulleted information quickly and easier than non-bulleted information typically. So, and I'll say too, when it comes to extracurricular activities, if you have extensive involvement in volunteer work, you can call this section volunteer activities or volunteer work, and just list the volunteer organization, the hours, or you can call this section student leadership activities if you have a lot of student leadership exposure, and you want to list all the names of the clubs that you were in and all the roles that you had. If you want to go specific with that and not just call it extracurricular activities, that's fine too. But if you have a lot of random stuff that you've been involved in, I think the best way to describe it is kind of extracurricular. Now, your reference section is going to be at the bottom of your resume, and it's typically always going to be the last thing you include. And I know at the beginning of the presentation, my promises were that I was going to provide guidance mostly. I will say the references section is probably one of the only areas that I'm probably going to provide instructions rather than guidance on, because this is an example section of something that has changed over time in the HR world, where it used to be okay for you to put the names of your references and the contact information like email, phone number on your resume. You don't want to do that anymore. You want to make sure that your reference section is at the bottom of your resume, and that all that's stated is is available upon request. And you want to make sure that you have another section of your resume that has, or a separate document where the names of your references are listed so that you can provide that information to the person that's going to be interviewing you later, but you don't want to actually list that on your resume itself. And the reason why is because you want to make sure that you're the first person to be contacted about your resume, not your reference. Because I know a lot of times we all think that we're putting people who are going to give us a great reference, but sometimes you might not get the reference that you're expecting. And so you might put Miss Allison down as a reference, but and I get your resume and you submit it to me, and I decide to call Miss Allison to get the reference before I even meet you or talk to you. And, you know, and in this fictitious example, by the way, I know Miss Allison probably wouldn't do this, but she might not give you the best reference. And based on that, I know Miss Allison for years. I trust that from her, so I might not bother calling you. Rather than me calling you first, finding out how great you are on the phone, and then calling Miss Allison up or another reference to reinforce, you know, that your application. And even if it's not that great of a reference, if I've already spoken to you and already have a good feeling and, you know, feel like you would be qualified for the position, I might still, you know, move you through the interview process. So that's why you want to make sure that you have them available upon request, but not include all their details, because you want to be the first person to be called and contacted, not your reference. And so in terms of how many references you would want to include, 3 would be the magic number. You would want an academic reference, so someone that could speak to your academic capabilities. So were you a good student, for example, stuff like that. Your second would be a clinical reference. So this would be someone that could speak to your clinical abilities or, you know, work experience if you were working in a clinical setting. But if not, this could be a clinical rotation instructor or a preceptor, someone that could speak to those skills. And then the third would be a character reference. So someone that could speak to your to those soft skills I was talking about, like leadership or time management. And I've seen people as like a pastor as a character reference, or a coach I've seen as character references. So those are the types and the amount that I would recommend. And definitely inform them. And like I said before, you would be surprised how many times, you know, people also include references or names of people, even if they've been put as upon request. They might get called once they are requested, and, you know, if they haven't been informed by the applicant, you know, it throws them off. They might say, and I've gotten feedback from references that say, I had no idea this person was even applying to jobs, or I didn't even know they were in nursing school. So, you know, so put people down that you are comfortable with being called, because they probably will be called. And just please let them know. I would give them a week in advance and ask permission to use them. I think that's always a nice gesture. So please make sure you do all that ahead of time. And this is some example of, well, this is an example of how you can kind of create your resume, the structure of it. So starting out with your name, contact information at the top, then going into your objective statement, then putting education, clinical rotation experience, and then extracurriculars and references at the bottom. This person has put, you know, this is all examples too, obviously, but, you know, we've have the same information up here with name, contact, objective, education, but then instead of school clinicals, they put their clinical work experience, non-clinical work experience, and then extracurriculars, and then references. So it's really up to you on how you want to create your sections, but just stay consistent. And once I email everybody the the document of the presentation, you'll get this example resume that I've created that, you know, it's for anyone that is really still having issues with understanding the whole how to write a resume. If you follow this structure and this, you know, these guidelines, you'll be in pretty good shape when it comes to writing a resume. I don't, you know, if you don't want to follow this, then you don't have to, but this is only for those students who are just really having trouble with the whole writing the resume process. And if that's the case, then go ahead and try to follow these little bullets in the example resume here. So I am actually going to go into the new section for interviewing, but I want to see, I see I have some chats here. I'll answer these questions. Well, actually, hopefully Ashley got her sound working, but I want to see if Renata and Kenny are on because I would actually like for them to talk now because I have y'all toward the end, but if y'all are ready now to talk and provide your tips, I would actually rather that if you don't mind. I see Renata. Renata, do you want to give a little background about yourself and also go into providing the students with some advice on what you are looking for when you're interviewing?
Sure. Good afternoon, everyone. I'm Renata Scheck-Snyder. I am the Assistant Vice President of Nursing for Ochsner Bayou Region, which includes Chabert Medical Center and then also Ochsner St. Anne.
I think, Renata, I think you're on mute. Sorry.
Can you hear me now?
I can see you.
Okay, give me a second.
But I can't hear you. I can see you're trying to talk. Let me see. What I'll do is I will keep talking into this interview presentation and you keep testing if you unmute yourself and once we get that, oh, let's see, we hear her. Okay, well, I'm sorry, you go ahead. I can't hear you, but as long as everybody else can hear you, let me see. Oh.
Okay, so
My volumes.
you guys can hear me? I think I'm saying yes. Okay, great.
I'm so sorry.
So as I was saying before, I am the Assistant Vice President of Nursing over at Chabert and St. Anne. I know several of you have done your clinical rotations through our facilities. And I wanted to first start off by just saying a big old congratulations. You guys are in the home stretch, and while this has been a semester, well, slash, you know, 2 semesters now that were unlike any other nursing school experience. I mean, I went to nursing school 15 years ago and we had our challenges, but you guys have overcome a lot. And so I just wanted to say congratulations because you guys have really been through the ringer in the last couple of months. So moving into a little bit about me, as I said, have been a nurse for 15 years. I graduated from LSU School of Nursing, and my first job was in a pediatric ICU in Texas. When I graduated nursing school, jobs were scarce in the New Orleans area. So I took the opportunity to go ahead and broaden my horizons and moved to Fort Worth, Texas, worked in the pediatric ICU there for a while. Did that for about 3 years and then moved on to some travel nursing, also in pediatric ICU. And then in 2007, I came back home, started working for Ochsner at Jeff Highway in the adult ICU, and later transitioned to their flight care team, so transporting adult, neonatal, and pediatric critical care patients from across the state back to Jeff Highway. Did that for 3-4 years as well, and then in 2000, I'm trying to think, 6 years ago, so 2014, I went over to Chabert as a house supervisor, and then have progressed through the ranks onto director of nursing, and then an expanded role as an AVP for the past 2.5 years. So some of the things, I have seen a lot of different interview styles, questions we like to ask. Everybody has a little different spin on it. So some of the things that we really are looking for when we're interviewing a new grad is you want to make that first impression as polished as possible. So you guys are going to be doing interviews probably through Zoom, alternate methods that we really haven't used in the past. One of the things that we really like to do with our new grads and really any new hire in nursing is a shadow shift. And so it's been kind of limited to be able to do that over the last few months. Some of that stuff is opening up a little bit, but we have not been given the green light to do shadow shifts on our unit due to COVID. So you want to make sure that your Zoom interview is very polished. You want to make sure you have the lighting correct. You've tested your audio. You look at the camera and make eye contact as best as you can virtually to the person interviewing you, because it's a really difficult thing to make those meaningful connections through the virtual interview process that are a little more natural in person. Some of the other things that we really look for is, you want to have a clean appearance. You want to make sure that your answers are appropriate to your level. For instance, Sam was talking a little while ago about putting your clinical experiences on there. So the nursing community is pretty small, and so I know what services are offered in the area at different hospitals. So if you tell me that, you're interviewing, I don't know, for my med-surg unit, and your favorite thing you got pulled into at Chabert, per se, was a neurosurgery, and you were just enamored about that, that's not a service we offer there. So you want to make sure that you're keeping, even whether it's nerves, because they can get the best of us, or you don't want to over embellish the situation, because we will be able to see through those things. A lot of the interview questions have really shifted over the years. So we used to do a lot of, tell me about your strengths, tell me about your weaknesses, but they're more situational based right now. We want to get a feel for how do you critically think. And so some of the things Sam was mentioning, I got to catch, probably the last 10 slides or so. When you talked about the extracurricular activities, make sure that whatever's on your resume, you think through how can you tie that back to your career as a nurse. So if you held a leadership role in an extracurricular activity or an organization, that translates into leadership skills, that translates into organizational savvy and balancing stakeholders and balancing shifting priorities. So you want to think about what roles you've had outside of your nursing school experience and how you can translate those into practice. The workplace is very different from when I started as a new grad, and so those skills are very important. Some of the other things I would say is that we really want to make sure that everybody understands, like, you're stepping into a role, and the expectation is we're hiring you into that role, and we need you to fulfill a purpose. So ask the questions that you have. Don't just agree with whatever's being said, and then you're on the job 2 weeks in and you're like, oh, well, I really didn't want to work nights. I just took the first job I had. That's just really bad form, and it kind of works maybe not necessarily the best way for you. So ask. If the position is a night shift position and that's not something that works for you, consider whether or not you can really commit to that position and accept it. That's probably one of the things that we run into a lot of. Nursing is a 24/7, 365 sport. I mean, this is not, we need nurses at night, we need nurses on the weekends, we need nurses on holidays. I've worked them all. I've been there with you. We're going to be there for hurricanes. We're going to be there for COVID, and God knows what else might come our way. We learned a lot over the last few months about our, resiliency as a profession, but mostly our commitment as a profession. And so you have to really make sure that you understand the position you just committed yourself to. Like I said, the questions are going to vary from, tell us a little bit about yourself, and we'll review your resume and use that as a guide. But also, tell us about a time that you went above and beyond to meet someone's expectations. You maybe haven't had that type of experience in a clinical setting, or maybe you did. Maybe it was how you went above and beyond to help the patient do X, Y, or Z, or help the nurse you were precepting with. Or maybe it's that you have some other skill set in a prior job or a prior career that can translate into kind of what Sam was talking about, the bartending skills, and how that's a shuffle, and you're balancing a lot of priorities at once, and that translates into probably a great ED nurse, So those are kind of the things that I would really focus on, ask your questions, because especially, like I said, right now, when you won't have the opportunity to do a shadow shift where you could really kind of get your eyes on the unit, see what you really maybe have more questions about, but really make sure your questions are answered before you choose the job. Anyone out there have a question? I have the chat up, so I see Allison just said, problem solving in group projects. That's true. You guys have all managed school at home. That's a big skill. Play that up in your interviewing. But I'm happy to take questions if anybody has any questions at this moment. Anyone? No? Okay, so this is a question. Should attire be scrubs or business for a Zoom interview? I think either way, if you have business attire, it's probably a little, scrubs, I guess, may look a little different in Zoom. But if you were doing an in-person interview, I think either would be appropriate. If there was a shadow shift, we would definitely recommend doing scrubs. But I guess from my personal perspective, I would probably say business attire if you're sitting at home or Zooming in for an interview.
Yeah, and that's and I'm actually too going to go over a few of those points, Renata. And
Okay.
I'm glad you talked about that. And I actually am really glad that you spoke about the Zoom interviewing. And I'll say that a couple of things that I unfortunately did earlier today, you wanted to not. And let me begin by saying I thought that I had my webcam on, and I, unfortunately didn't. And then I also had myself on mute, and then, but I didn't know that. So I, first of all, apologize for not that everybody could hear. I'm so embarrassed, but that's why it's important. And we all saw how that played out, right? It's kind of awkward. And so you don't want that to happen during an interview. Now, I mean, we're all in a semi-safe space here. We're all learning. We're in a learning space, but you definitely don't want that to happen with a meeting like Renata, for the position on the Zoom. So I would even recommend testing it out with a friend ahead of time that day, making sure that you're not on mute and that your video is clear. That would be my recommendation. Sorry to jump in on that, Renata. I just want to apologize.
No, I think you bring up a good point, because nowadays with the Zoom technology and things that we are doing in ways that we've never done them before, to be fully transparent, I'm on vacation right now. So I'm taking this call from a vacation home. So when we got settled in last night, that was my first thing. I jumped on and made sure Zoom worked, made sure the internet was, connecting well. This is the third meeting I have today for work from Zoom, but that's just a new part of our everyday world now. So you want to make sure you're familiar with the platform and everything, that there's good lighting, we can see you, because that's another thing. One of my offices is really dark. It's just the way it's configured. So we had to add some lights, because when I'm on conference calls like this, nobody could see me. I kind of looked like I was in a witness protection program. Everything was light around me, but you couldn't see my face. So you want to make sure you just kind of tested all of those things, because when you work all those kinks out ahead of time, you will be more comfortable on the interview, and then you'll present your best self. You don't want to be in one of those situations where everybody's like, wait, we can't hear you, we can't hear you.
Yeah.
And then that kind of, really distracts from the meat and potatoes of what you have to say about yourself and you selling your best self. I will say another thing that, along with the same, this virtual interviewing and the technology piece that comes along with it, it's a little different to be in your home and still be in work mode. Like, it's kind of one of those balances you have to really shift, like kind of block all the distractions out. But we were on an interview last week, and so this is a, fresh off the presses kind of thing that I would say a big do not do. And it was for a relatively experienced leadership position. And we were sitting there, and the candidate, we heard a beeping sound in the background, and the candidate was like, "Oh, I'm so sorry. I have a zucchini in the oven. Let me go get that." And just like literally walked off the screen. And I'm like, what is going on? So, in things that you would not experience if you were at work, you need to make sure that your time priorities are balanced and that you have the, no distractions. Yes, I understand we all have to cook and eat dinner and stuff, but that probably wasn't the best time management skills she could have used to have something she was cooking finish in the middle of her interview. And then, just immediately left the interview for a few minutes to go take care of that. So that's probably a big what not to do, a big example, glaring example of, this is still to be treated like a real in-person interview. And just like you wouldn't take out your cell phone in the middle of your interview with me if you were at the hospital, if I can all of a sudden see that you're like this, looking down the whole time, it doesn't seem like you're very engaged and participating in the interview like you would if you were in person. So let's see, I have another question. Is it okay not to have the video on and just a professional picture upload to your profile? I think that varies depending on what you're doing. So I personally, for the interview, would probably be, if you were interviewing with me, I would probably ask you to turn your video on. It does make it a little more personal. And with that being said, you need to be prepared for, I guess, your appearance when you're going to be expected to be on video. So I would say for an interview, I would definitely start with video on, or, and then that way, if the other person isn't and you want to turn it off, that's fine. But some of the other things that have happened when we've seen the, like, okay, everyone turn on your video, and you've got somebody driving, you've got somebody, you've got distractions all around. Make sure there's nothing, I hate to say this, but we've seen this too, nothing inappropriate behind you. You want to make sure you have a professional backdrop. While on the terms of backdrops, Zoom does have some of the, you can change your Zoom background, and you want to keep in mind what's the setting and what is the intent of the meeting you're in. So if you're in an interview, as cute as the, beach scene can be in the background, it's probably not the most professional thing you can have up. As well as I've been in meetings where people have showed up with their Zoom background, anywhere from the Tiger King to Harry Potter and all kinds of other things. And while those things are funny and kind of comical for maybe classroom presentations, or like, group meetings with your classmates, probably not the best thing for a professional interview. So I think the current state we're in with the virtual platforms really presents some challenges that none of us have had to face before. We've all worked through them on the leadership side of things and making sure that, I have a team of, about 25 nurse leaders. And so nurses in general are very touchy-feely, and we're used to all being in the same room for our meetings. So it's kind of learning to make these meetings as comfortable and as connected as we would be if you're in the same room. Any other questions?
What I'll do too is, I didn't know how much time I was going to have you for, which is why I had you come earlier. But if you don't mind, I was gonna go through my slides.
Okay.
I would love for you to stay on if you could.
Yeah,
Um,
I have time.
okay, and then I wanted to. I see Kenny is on. If Kenny was
Yes.
talking afterward on what the interview process might be looking like nowadays. If not, we can speak to that too. But I think it's really interesting. You know, like I was talking about earlier, like things kind of change over time in the HR world. I mean, that's just in the world in general now. So
Yeah.
hopefully we'll be able to give you some really fresh information and up to date on what's going on. But I just want to hurry up and provide y'all with the basics of what I typically provide for the presentation, just in terms of what to do before, during, and after, because I want to respect the time frame that I agreed with Miss Allison on, or because I know I'm running a little bit over, so hopefully y'all can stay. But the before the interview portion of your preparation is really going to involve company research. So what is the organization that you're applying to? Like, what are they all about? Information relating to that. You're also going to want to get a little idea about the job itself. And then also the logistics of the interview, which kind of goes to what Renata was saying. When, typically in person, we're referring to driving, making sure that you're giving yourself sufficient driving time, knowing where you're going to park typically is what I kind of like hammer on. But nowadays with the with Zoom, we're talking about making sure your camera's on, making sure you're not on mute, making sure you have a professional background. So hopefully we could turn those lemons that I had into some lemonade today just on that. But I think it actually really is effective. Hopefully that y'all got takeaways just from that example. But that's the logistics piece. And then also what to wear. And then the questions are going to be really, really important. And I have a list that I'm going to share with y'all. Well, actually, that's the next slide. But in terms of the research, we know that you're in your final year typically of nursing school at this point, and you have a lot to memorize already with school, and then you're going to have to start studying for NCLEX. And so I say all that because I'm not expecting anyone to go on, for example, ASHRA's website and memorize mission, vision, values. Like that would be something I would advise not to do. However, what I am advising is that you go online, and if you don't know websites, just go on Google and search Ochsner Health or Ochsner Chabert or Ochsner St. Anne and see what comes up. And hopefully you're going to find the official Ochsner website, because you really want the primary source, which we know is going to, you don't want like secondary sources in terms of like reviews yet. You want to go to the actual website of the organization for this company research part. And see what they're putting out there in the world. Like, are they listing that they have values? Are they listing that they have a mission? The reason why is because you will probably get a question that is going to be behavioral based, the majority of them, and I'll talk about what that means. But one of the questions you're probably going to get is, why are you applying here? Like, why are you applying to Ochsner? And that would be a really hard question to answer if you really didn't know about Ochsner, or if you didn't do a little research about either Ochsner or North Oaks or West Jeff or East, like wherever you're applying to, Thibodeau Regional. That's why you want to get a little bit exposed to that, because if you knew that Ochsner had values, for example, you didn't know all of them, but you know that they said that they had them, you could say, I didn't memorize the values of Ochsner, but I know that they have posted that they have, that they're a values-driven organization on their website, and they focus on compassion and patients first. And, I'm really drawn to that. And I was really inspired by those two values. And that's one of the reasons why, I want to work at Ochsner. And that would be, quick, easy answer, but based on some very rudimentary research on the organization. The job description, You also don't want to memorize every little bitty piece of information about the job, right? But one thing I would recommend that you at least know is the name of the unit and possibly the largest patient population, or if applicable, if that makes sense. So let me give you an example of the name. So I had, especially nowadays, it's like a bowl of alphabet soup with some of these unit names, just because everything has its own acronym. Sometimes organizations will just post the acronym online, and you're like, what does GISSU stand for, or what does MSU stand for, or TSU? Knowing the explanation behind those acronyms is going to be at least one thing you want to know as part of the job description, because that could help with that, the second part, like patient population. Like GISSU, for example, is GI surgical unit. So I would probably deduct just from that they're probably dealing with maybe either pre-op or definitely post-op surgical patients, probably have a lot to do with GI or abdominal surgery areas. I mean, in reality, they take pretty much any like all general surgery type patients in this one example, but knowing the name is going to be important. Logistics, we already kind of covered that. I won't really go too much more into that. I think the relevant pieces is what Renato was talking about with the Zoom, because that's how we're doing things a lot now. But at the end of the day, with the dress code though, because that kind of ties into interview logistics, if you do get the opportunity to get into an in-person interview, I would definitely recommend either, first of all, making sure you verify with the person that you're setting up the interview with what you should wear. And I used to have a slide on what to wear, like for, what is business attire and like what that means. I took that out because it was confusing. I felt like it was more confusing than it was helpful. And I think at the end of the day, if that is something that you need more clarification on, ask the person that you're setting the interview up and say, hey, my interview is going to be scheduled for next week. I'm so excited for it. I don't really know what, y'all would want me to wear. Like, what would you recommend? Or what is the hiring manager's expectation? Is it that I come in my school scrubs and my school ID badge? Or do they want me to come dressed business attire? And you can even ask what that means to them, because an organization business attire, their definition could be different than another. And that's why I want y'all to be very intentional with the person that you're setting it up with, that you get those details from them, because you might open it up to different possibilities if we just talk about like, this is what business attire means, because it could differ. And I've seen it in real life, which is why I talk about it in this way. So definitely get that information ahead of time, please. And then the questions, I will say that the interview questions are so important to have as a candidate, that if you know that you don't want that job, and after you meet with someone like Renata or someone like Kenny, and you decide like, I don't think that's the job I want, the quickest way to end the interview is to not ask questions. And that's how important the question piece is, because that's usually an indicator that you're not interested, that the recruiter or hiring manager should end the interview at that point. But if you are interested in the job, you really should try your best to come up with something to discuss when they bring up the "do you have any questions for me" part of the conversation. And like I said, they're so important. Like, I've actually written them out for y'all to have. And I think this is a great list, and I'll email it out to everybody, like I said earlier. But if you're also someone like me who you might get nervous and forget to ask, like, you can print these questions out in advance and have them with you in a folder if you're doing an in-person interview, if you're doing a Zoom interview or a digital virtual interview, have them on the side ready to ask, because they really are important. And I always liken the whole job hunt experience, or you applying for your first job, to purchasing a car or buying a house. Like, and I even think it's even more important and bigger than those two. But it would be like you about to drop hundreds of thousands of dollars on a new home without, asking a few questions about the house, or like, is this, what's going on here? Is like, does the house come with this? Like, when you ask questions, it shows a level of engagement where you're interested. And you want to make sure that before you make the biggest investment, which is your time, because you're going to be spending a lot of time in this role as a nurse, right? That you at least ask a few questions, and you can rephrase them too if they've been answered already. So like if they already answered that training and orientation is going to be 8 weeks, and that was your training and that was one of your questions, maybe you can say, I heard, you said that training and orientation will be 8 weeks, and that's awesome. Like, I'm excited about that. Is it going to be with one trainer or a preceptor, or we'll have multiple trainers or preceptors? And that would be a way for you to rephrase that question or add on to it to form discussion. So I know it's kind of an art, and I know y'all aren't experts on interviewing. You're more of experts on, student nurses, and getting your job as a nurse, but it is important to look into that. And I see you trying to say something, Renata. Go ahead.
Can you hear me now? I'm sorry. I just saw them saying they can't hear me. Great.
Thank
Sorry
you.
about that, guys. One of the things I was saying was to piggyback onto what Sam was saying about training and orientation questions. So, you want to ask, what does that 8 weeks look like? For us, on my med surg units in particular, and my ICU units, your 8 weeks, some of it will be spent on nights, some of it will be spent on days, some of it will be classroom type settings. So the more you know going into that, that'll show some interest. Like, okay, I picked up that it's 8 weeks, but what does the 8 weeks look like? On med surg, where you may work yourself up to 5 patients, we start with like a stair-stepped approach. So for 2 weeks, you and your preceptor are kind of elbows to elbows. And then as they feel like you're getting a little more autonomous, they might say, okay, I'm, as the preceptor, going to have 4 patients. This one patient is your patient, but I'm going to be right here. Like, you come to me, you take the lead on this, you come to me with questions, and we gradually build you up to where that last week of orientation, that 8th week, you have the 5 patients, and the preceptor's kind of, okay, I'm, the training wheels are coming off. I'm back here. You tell me what you need, but we let you take the lead. So you want to make sure you understand what that orientation looks like. That's probably one of the things you can do to relinquish some of the anxiety that is going to be inherent no matter where your first job is. I mean, I can remember I moved 800 miles away from home for my first job, and the night before, I don't think I slept 2 hours. So the more you know about what you're getting into, the better prepared you'll be. That's kind of what I was just going to say.
And I know that I'm running low on time, and I don't know if y'all have another class after this, so I'm so sorry. What I can do is I'll finish this presentation with anyone that wants to reach out to me, I guess, individually. Like, we can have a phone conversation and schedule the remainder of the presentation maybe on a day that works best individually for each of the students. But before we end, I do want Kenny to jump in. Kenny, did you want to talk to the students about some of the recruiter processes or anything they need to know about interviewing?
Sure. And quickly, guys, good afternoon. My name is Kenny Yeabear, and I am the recruiter here for the Bayou region. So again, Chabert Medical Center and Ochsner St. Anne. Big congrats to all of you guys for getting to this point. It's the home stretch, so congrats. But yeah, just very quickly, as far as our positions, you can find those on ochsner.org/careers. You can directly apply to those there. And then you'll be hearing from me soon afterwards. You'll be talking directly to me. We'll discuss the positions a little further. I'll gather a little bit of information from you through a phone interview process, and I'll forward that information over to the managers. And then those guys will then be reaching out to discuss next steps, which at this point will more than likely be a Zoom interview. But I will walk you through the entire process. If you see any positions that you have questions about regarding shift, schedules, that sort of thing, definitely feel free to reach out to me. I'm sure Sam can get you guys out my contact information, and I'll be more than glad to help in any way that is needed.
Thanks for that, Kenny. And what I think I'm going to do is I'm actually recording this. So I'm going to continue, and anyone that can stay, feel free. But if y'all have to drop off for a class, then please drop off, and I'll send you all the actual recording of the presentation. But I'm just going to keep going. And if y'all have to jump off for class, feel free. But I want to make sure I cover this so that it's on the recording so that y'all could see it either later or you can hear it now if you can stay. But thanks again for that, Kenny. I really appreciate you telling us about it, because even I myself, am very curious on how things work nowadays. And I've already learned a lot from Renata in terms of what she's been doing with the virtual interviewing, which is interesting. I saw someone ask about a mask. I would say if you have a in-person interview scheduled, then you would probably definitely want to wear a mask of your own, bring your own mask. Renata, do you have any comment on that?
Yeah, most of the facilities are going to be following the state guidelines regarding PPE. So all visitors, all employees, everyone on all Ochsner campuses, everyone is required to wear a mask in any setting. So when I'm in my office alone, working alone, I can take my mask off, but in an interview, I would be wearing my mask. So you wouldn't really get through the front door without, if you didn't have your own, we would provide you with one. So you should be prepared to wear a mask. Also, you should be prepared to have your temperature taken wherever you're going. I can't imagine that. I know in all of our facilities, we are, there's stations at every door, and you'll have your temperature taken. They'll ask a couple of symptom questions, and then if you're cleared by that process, they'll give you a mask, and they'll put an armband on you just to say that you've been cleared through our temperature check station. So I think that's kind of standard protocol around the region right now.
Yeah, thanks for that. So hopefully I answered that question. But the interview questions, though, I think this is a solid list, y'all. So definitely be prepared to ask at least one of those if you maybe don't have your list already. These are pretty tried and true questions that would work. During the interview, definitely be on time, regardless if it's virtual or physical. Really important to be on time. Maybe 5 minutes getting ready to click the Zoom link or WebEx link 5 minutes ahead if that's the case. But if it's in person, my recommendation is always 10 to 15 minutes. But no earlier than 15 minutes, because there is such a thing as maybe too early, but arriving for a 10 a.m. interview at 10 a.m. is, for many, could be considered, even though it's right on time, could be considered a little late. So you would want to definitely come and be at least ready at the nurse's station if that's where you're supposed to meet, or on the unit at registration. at least like 5 to 10 minutes, if not 15 minutes. But that 15-minute mark for in-person interview would be the earliest, in my opinion. If you're also doing a physical interview, I would even recommend you test drive either in person or Google Map the commute from where you live or where you'll be at that day to the location of your interview. And I like that because if you also do it during that exact time, you'll see what the traffic might look like at that moment. So let's, for example, say an ideal case, it's today, which is Wednesday, and you're making your interview for 3 p.m. next Wednesday. I would have recommend you go on the Google Maps at 3 p.m. today and see what the commute would look like from your starting point to the hospital or location that you're doing the interview, just to give yourself an idea. Because sometimes it might be 10 minutes as the crow flies, but not at 3 o'clock on a Wednesday. It could be maybe even 30 minutes. So you want to make sure you know that in advance so that you give yourself time to get there. Because also some of these hospitals or areas, the parking situation is a little complicated. So you also might need to add in 10 minutes just to park. And that's why I also definitely recommend getting there in person if you can, ahead of time, to do it a practice run. But we don't all have that time or resources, depending on how quickly you make that interview to do that. But be on time, essentially. Like the hiring managers, especially at Ochsner, but at many places, are typically working managers. So they're also on the floor helping the charge nurse, helping each bedside nurse with things if they need help at times. So they might be addressing a code right before they come into your interview that wasn't scheduled, right? The code wasn't scheduled, obviously, but they didn't know that, but they have to go address that. Now they're coming into your interview, or that could, they might have something immediately scheduled after your interview, which is why showing up on time or being at least ready is going to be important. And the whole code example goes into the whole concept of not showing up empty-handed and maybe bringing in your resume, because in actuality, they may have already printed out your resume, but they may have done something immediately before where they weren't expecting to do that, and the hiring manager now doesn't have access to your resume. But if you bring it, then that alleviates that problem. So that's why it's a great idea to show up with at least 5 copies. I would even recommend you try to ask the recruiter or person you're setting the interview up with, ask them in advance, like, what does the interview process look like? Would I be meeting with just the hiring manager, or am I meeting with anybody else? And that kind of gives you an idea of what to bring and how many copies, if needed. I'll also say, if you are the person that needs pen and paper to write notes like I am, I would recommend that. I think it's completely professional, and and it happens a lot to do that. So you can definitely show up with pen and paper to jot down notes, or with interview questions. A water bottle is also acceptable. I've gotten questions about being able to drink liquids, especially because you'll be talking a lot. And also someone like myself who can get dry mouth sometimes, you need a little water. So that's fine. I would avoid though, the Starbucks, Frappuccino with extra whipped cream beverage though, because that might be too much, but standard water should be okay. And then the body language is going to be important, only because I had a hiring manager tell me once she interviewed somebody, and if y'all can see me, the person had their arm on their head with their elbow facing the top of the ceiling, but on top of their head, the whole interview. And that's one of the most extreme body language examples, but I don't know if that candidate even realized that they were doing that. But just be cognizant of anything, or like tics. That's the only thing I can think of. Like if you do that when you're nervous, put your arm on your head, or if you like, touch your beard, which is my example of being nervous. Like don't, avoid doing stuff like that, or like twirling your hair. Make sure you're focused and you have that professional posture with, try to keep your back as straight up as you can, and eye contact with the person interviewing you. If it's virtual too, I would try to stare at the camera as best as you can. I know that's really hard, but don't overthink it. If it's getting to a point where your nerves are getting, out of control because you're so nervous about looking at the camera, you might want to prioritize other things that you want to put first. If your nerves are kind of overcoming your interview, where you're not even that person anymore because you're so nervous, which we get that too. And I have another hiring manager that says, if you're so nervous where you're coming across not yourself, they like to hear you acknowledge that and say, hey, this is a really nerve-wracking experience for me. I really want this job. I'm passionate about working at Oshner, but I'm just so nervous. I do want to just let you know, like, I'm usually not this nervous. I think that's okay for a lot of people. And maybe Renata could talk later about that in terms of what she thinks. But smiling is also the last thing I'll say, because at least showing the hiring manager that you can smile is going to be important. You wouldn't want to, smile the whole interview probably, but your role as a bedside nurse or any entry-level nursing position is going to be a lot of you going, meeting people that you've never met before, and helping them get to a level of, patient satisfaction, or showing vibrancy, or, going into a room, meeting someone that probably doesn't want to be there, but helping them feel comfortable. And so that's what the smile does. It shows that you can do that. And that's going to be important. So at least showcase that you can smile. The behavioral-based interviewing is definitely something I wanted to review with y'all today, because it is important. In the past, the HR way of doing interview questions was very focused on hypothetical situations. So an example of a hypothetical situation would be, what would you do in this situation? That's not how we interview anymore. And by the way, that's across all industries, not just in healthcare. Everybody, all industries are doing the behavioral-based interview. And the concept behind behavioral-based interviewing is not what would you do in a situation, it's what have you done in a similar type of situation, because the research suggests that previous behaviors are apparently a good indicator for future behavior. And although we might not always agree with that, that's just what it is. And like I said at the beginning of this presentation, I really am here to tell you what's current and what the current trend is. And it's a lot. And as it relates to the behavioral-based interviewing, it's focused on action items and behaviors that you've done in the past, because that is the indicator of what you might do in the future. And that's the rationale behind behavioral-based interviewing. But there is a way to approach the behavioral-based interview question. And I think the best way for me to describe STAR is to show you an example of a question first. So a behavioral-based interview question, and these are actually some of the questions at Oshner. In case you're interested in Oshner, definitely look at these questions, because we could very well ask you these in a real interview. But give me an example of a time you had to work in a team or on a particular project. What was your role in helping the team reach a final solution? That clear example of, tell me a time where you worked in a team. So previous behavior, previous experience. So the question should be approached in this way with STAR. where S stands for situation, T stands for task, A stands for action, R is for result. And we use STAR as a way to describe what we did in that situation where we had to work in a team. Because essentially what you're having to do with the behavioral-based interview question is recreate a real experience that you had that is relatable or relevant to the question you're being asked. And that's complicated, by the way. It's not easy task at all, which is why STAR is going to be really important to remember in the back of your head. But the one thing that you really need to make sure that you do, and the most common error that I see when new grads or experienced interviewers answer the behavior question, is they forget the prepare part, which is not part of STAR. They probably should add the P part. But the problem happens where you want to immediately answer it without thinking or spending silent time, because I feel like a lot of candidates, they get nervous about that silence, right? That silence is really important though, because as human beings, we need to think about things, right? I mean, I want to normalize the silence because I feel like a lot of people are very afraid of it. It's normal to be asked a very complicated question like the one that we asked about teamwork, and then for you to think about it. How are you going to answer that question? Because you're going to have to pull out a real experience. And if you feel awkward about it, you can say, oh, that's a great question. Would it be okay to spend a few seconds or, thinking about how to answer it? But you don't even have to say that, but that's what you can say if you feel uncomfortable about that time, but you have to prepare. And I really want to make sure that you all internalize that and understand that that's probably the most important part to start. And then you can go into talking about what was the situation, what was the task. And I made up a fictitious example of how you would answer this, because I know we're short on time. I won't go over each one of them, but I want y'all to read this example because I think it's pretty much it's a great prototype on how you would approach the teamwork question using STAR and explain the situation, the task, the action, and the result. And let me just say this before we conclude that even if your only example is an example that doesn't conclude with a positive result, so maybe the result for your teamwork was that, you didn't get a good, it was your teamwork example, there's the only example that you had, but you got a C on that project or something, if it was a project example, talk about what did you learn from the experience then. And I don't like the word spin, but you want to make sure though you take what could have been lemons and turn them into lemonade, if we use my example from earlier. Like, how do you take what could be seen as a negative result, but turn it into a positive so that you could still use that example to answer the question, because you got to make sure that it's a relevant example that's real and not made up too, by the way. So immediately after the interview though, you really want to make sure that you ask whoever you're talking with what the next steps are going to look like. So it could look like this, I'm interviewing with Renata, we finished the interview. I can ask, Renata, thank you so much for your time. Before we disconnect virtually, what do you think is going to be my next steps? Should I reach out to Kenny or should I wait to hear back from you? You want to make sure you get that information before you disconnect, because you want follow-up even if you didn't get the job, right? The reason why you want that follow-up even if you didn't get the job is you want to make sure you use any constructive feedback on why you didn't get the job, if they're able to give it to you, so that you can leverage that and fix it for future jobs. So if you were that person that didn't smile at all during the interview, and that might have been one of the reasons why you didn't get the job, You want to know that so that you can smile or at least pay attention to smiling, and do it at least once for your future interviews. And so that's why you want the feedback. It's really important that you get that information. I think also getting the hiring manager, at least their email address to send a thank you email is always a nice touch. I'll never forget, I had somebody, I was doing tours at one of the hospitals, and I had somebody come on the tour. She was still in school, about to graduate, but she had blank thank you cards with her, with a pen at the end of the tour, in order to write out the names of the hiring managers that we went to go visit, and write them each a thank you note. It was really incredible, and that was kind of like above and beyond. And she got a job that day. She got offers essentially from every single person that we went to visit. But that's a great example of a post follow-up thank you, message. And it doesn't have to be in a card, by the way. Email is probably great, but just know that that's what some people are doing, just to let you know. And definitely, if it's been a week, call either the recruiter or whoever you set the interview up with, if you haven't heard back. But after 2 weeks, if you haven't heard back, I would recommend reaching out to the hiring manager and just letting them know, hey, I haven't heard back from the recruiter, are y'all still, hiring for this job? That would be my recommendation. And that's what I have for that. Renata kind of already spoke. That's our website in case y'all are interested in applying to Ochsner jobs. The way that you would do that is go to ochsner.org/careers. What I'll do is I'll send out the presentation to everybody as soon as we get off the Zoom, but I'll also include a link that all you'll have to do is click it. That will then bring you to the Ochsner website where you could see all of the jobs open. And then you can reach back out to me if you want specific information about a question. And Kenny, would you be okay if I included your email too? I hate to put you on the spot. If
Definitely. Please include it, and definitely feel free to reach out to me, guys.
Alrighty. Any last minute questions? Let's see. Okay, I'm actually just going to scroll up to see if I missed any other questions, by the way. Should attire be scrubs or business for a Zoom interview? Renata, did you answer that already? Okay. And I would definitely also say that if it's an in-person interview, and you don't know the answer to that question, I always would recommend going dressed business attire with a pair of scrubs on the side that are your school scrubs, with clean tennis shoes, your student ID badge, maybe in a bag, just in case they want you to jump in scrubs to do after, this is very probably in the future after, a lot of the COVID has kind of like died down a little bit. And if we're doing like shadow shifts, that's what I would recommend, that you go in with both just in case. But let's answer that.
I think part of the attire thing too is that's one of those clarifying questions you can ask ahead of time, whether you're talking to the hiring manager or the recruiter, because if there is a shadow shift involved, it would be definitely expected that you're in scrubs. And so you can do your interview in scrubs while on the same day that you're doing the shadow shift. Now, if they're separate, you may want to do business attire for the actual interview and then scrubs for the shadow shift.
Okay, awesome. Any other questions? Because I think we got them all so far. 1, 2, 3. That's my 3-second count. I haven't gotten anything then. Thank you all then for staying on. I really appreciate everybody's involvement. Thank you, Renata and Kenny and Ms. Allison. Thank you for letting us present to your